Hello, I'm Victoria Hunt, and I'm doing my physical assessment on Miss Whitney Mason for our Nursing 341 class. And we're going to get started. Hello, Miss Mason. My name is Victoria, and I'm going to be doing your physical assessment today. It should take approximately 30 to 45 minutes. Can I get you anything to make you more comfortable, or do you need to empty your bladder? Good. We're going to make sure we provide for privacy for you. All right. Let's just start with your name and date of birth.
Whitney Mason, 22192.
Good. Can you tell me what year it is?
It's 2017.
Can you tell me where you're at right now?
Madisonville Community College Health Campus.
Good. Can you tell me who our current president is?
Donald Trump.
Okay. Patient is alert and oriented ×4. Can you tell me what you would do if you were walking down the street and you saw a building on fire?
I would call him.
Good. Reasoning is intact. So looking at the patient, she walked into our clinic today, so we know that her mobility is intact. Her speech is clear thus far in the assessment. Her affect is pleasant, cooperative, and calm. She is dressed appropriately for the season and looks appropriate for her age. So if you'll just kind of look at me, I'm going to just get a general look at your head. Patient's head appears to be normocephalic. Any tenderness? Okay, so no tenderness, soft spots, masses or lesions noted. Looking at the patient's facial features, her eyes, nose, mouth, and ears are appropriately placed, symmetrical, and nothing looks set. Looking at the patient's eyebrows, they are bilaterally present with even hair distribution. The patient's eyelashes, if you'll close your eyes for me, are present and evenly distributed bilaterally. Okay, you can open your eyes. Patient's eyelids move symmetrically when the patient blinks and looks around the room. All right, so the next thing I'm going to do is just kind of do a little eye assessment on you. You'll just look at me. Patient's pupils are 4 millimeters bilaterally. Her sclera is white. Check your conjunctiva. I'm going to pull down now. Conjunctiva is pink and moist. I'm going to palpate your sinuses. Frontal, maxillary. Any tenderness? Good. No tenderness noted to the frontal or maxillary sinuses. I'm going to check your accommodation. You stare at my finger. Now stare at the far wall. Pupils bilaterally are accommodating correctly. Next thing I'm going to assess is shine a light in your eyes. I know it's a little bright and uncomfortable, but just bear with me for a second. Okay. Okay, just look at me. Left and right eye are bilaterally brisk and consensual with direct and indirect response. Okay. The next thing I'm going to do, Ms. Mason, is I'm going to look at your nose. It's symmetric in shape. Her nose is deviated to the left. Can you cover your left nostril and breathe in? Cover your right nostril and breathe in. Both nares are patent. Just going to kind of look up in your nose. I've got a clean cover here. Nasal mucosa is pink and moist. Turbinates are present bilaterally, and the left was also pink and moist. No drainage was noted. Okay, I'm now going to assess for the red reflex. If you could just look directly at me. Red reflex was present in the right. Red reflex was present in the left. The next thing I'm going to do is I'm going to assess your mouth, okay? So the lips, I don't notice any lesions or wounds on the outside. They have an intact. Okay. Can you smile for me? Patient has all of her teeth, no caries noted, and her gums were pink and moist. Open your mouth for me. Say ah. Oral mucosa on both sides was pink and moist. Patient's tongue was pink and moist and appropriate for the size of her mouth. Tonsils were bilaterally present. The hard and soft palate were intact, pink and moist, and the posterior pharynx was visual and pink and moist as well. tragus and mastoid, and there is no tenderness or pain noted. I'm going to now look at each ear. But first, can you cover your left ear for me? I'm going to whisper a word, and I want you to repeat it back to me.
Okay.
Cat was correct. I'm now going to look in your right ear, Miss Mason. Pulling up. Okay. Tympanic membrane is gray and curly with a cone of light at 5 o'clock. Her ear canal is pink with very minimal drainage of your lax. Okay. I'm going to have you just hold this for me so we don't get it dirty. Okay, pulling up and back again. No drainage is noted. Ear canal is pink. Tympanic membrane is gray and curly. Cone of light on the left is at 7 o'clock. You'll hold that for me, please, Miss Mason. Oh, excuse me, I forgot to do the whisper test on this side. Can you please cover your right ear? I'm going to step back and whisper a word to you. Just repeat it back to me.
Bird.
Bird was correct. Patient passed the whisper test bilaterally. All right, Miss Mason, can you please just sit up and sit onto that? There you go. That's fine. You can just sit right there. So I'm going to start by palpating your carotid on each side. +2 on the left. +2 on the right. Trachea is midline with no deviation. Just going to take a quick listen, make sure there aren't any bruises, okay? Bruises are not heard bilaterally. Go ahead and sit on the edge of the bed for me, Miss Mason. Next thing I'm going to do is assess your thyroid, and I'm going to come back around and do your cervical lymph nodes, okay? All right, here's you a glass of water. Just please wait to drink it until I tell you to. Okay. Going to come from behind, find the area where the thyroid would be. Go ahead and take a drink and swallow for me. Good. Thyroid was palpable upon swallowing. It was bilaterally symmetrical. I didn't notice any masses or lesions upon feeling, so that's a good thing. All right. Next thing I'm going to do is your cervical lymph nodes, okay? So I'm going to start here, work my way down, and even into your arms, okay? So the first one I'm going to do is your pre-auricular, post-auricular, occipital, tonsillar, submandibular, submental, superficial cervical, posterior cervical, deep cervical chains, supraclavicle. Going to reach in on each side of your gown, okay? We have your cervical, your lateral, we have your pectoral, and we have your post-scapular. Going to do the same thing on each side. Any tenderness anywhere on any of these? Good. No masses, lesions, nothing I felt that should not be there at this time. The next thing I'm going to do is I'm going to do your post-thorax and then your anterior thorax, okay? So I'm going to listen, percuss, do a little feeling, but I'll direct you throughout the exam. On your posterior thorax, I'm just going to uncover you for just a moment. Pull it up on your shoulders. Okay. Patient has regular unlabored breathing. It's been about 14 breaths per minute throughout this exam. Upon breathing, you can see that posteriorly, and when I was in front anteriorly, it was a 2-to-1 ratio, but I've checked that with the symmetrical. So, take a deep breath for me. Expand. expansion was equal bilaterally upon the patient taking a breath. I'm now going to auscultate, okay? There are several areas. So as I place my stethoscope, just take a deep breath in and out on each one through the mouth. Okay. All of the patient's lung-filled lobes are clear throughout upon auscultation. I'm now going to feel your spinal processes. Just kind of lean forward a little bit for me. Cervical, thoracic, and lumbar spinal processes are noted. The posterior vertebral muscles are also noted and palpable on each side of the patient's midline spine. I'm now going to percuss all 10 areas and then check for CVA tenderness. I'm going to place my hands and you're going to feel like a tap just like this. Just breathe normally, okay? Gotta get under your sports bra. On percussion, all of the lung fields were resonant throughout. I'm now going to assess for CVA tenderness. I'm going to place a fist, and you're going to feel me kind of pressing in on the back, okay? Any tenderness? No. No CVA tenderness was noted upon examination. Here, I'll help you cover that back up. All right. Go ahead and lay back down for me, Miss Mason. Thank you. I'll cover you up though. All right. I'm now going to assess your anterior thorax. It's going to cover from right here to here to the start of your abdomen. You're going to listen for cardiac sounds, which I'll go over with you, and take a pulse and listen to your breath sounds. So let's just start with your breath sounds, okay?
Okay.
Maybe your breast tissue, I'm sorry. Okay. Once again, patient's breathing is unlabored and at a regular rate at this time. All of your lung fields, once again, were clear on the anterior. It's good to just check front and back. Sometimes you can hear different things, first anterior versus posterior. Now I'm going to listen to your cardiac sounds. So I'm going to assess for your PMI. I actually put my hands under your gown, but I'll keep it on top of you just to maintain your privacy. Okay? It's more in the fifth intercostal space, mid-clavicular. Kind of have to feel around very on the patient. PMI is noted and palpable. Okay. I'm going to listen to your cardiac. I'm going to go through the areas with you. So
Okay.
your second, right intercostal space, you have your aortic. Second, left intercostal space, you have your pulmonic. Third intercostal space, left side, you have Erb's point. Fourth intercostal space, you have your tricuspid on the left. On the left, in the, fifth intercostal space, you have your mitral, okay? And then your apical pulse is going to be about right here, and that's where I'll listen. I'm going to listen with the bell and the diaphragm, so this should only take just a second, okay? Take your apical pulse now for 1 minute. I'm going to come around to this side though because the clock is on that wall over there, okay? Patient's apical pulse was 85 beats per minute. I'm now going to just kind of assess the skin. My hands might be a little cold. No lesions, masses, pulsations really noted. Warm, dry with intact skin. We're now going to move on to your abdomen. We'll keep your lower portion covered for privacy. Okay, just upon visualization, I don't know any distension, inappropriate movements, or pulsations, including for the abdominal aorta, there's no pulsation. Okay, so I'm going to go ahead and take a listen to you. We're going to do the 4 quadrants of the abdomen, listening for your vowel sounds. Patient has normal active vowel sounds throughout the 4 quadrants. I'm now going to once again check for pulsation. Don't see any for abdominal aorta, but I'm going to listen for a bruit once again with the bell and the diaphragm. Then we're going to do the bilateral renal arteries, check your femoral pulses, and then check for a bruit in those as well. Okay. No bruit is noted in any of the renal arteries. Now I'm going to assess the femoral pulses. Kind of right on your panty line. My hands might be a little cold. I apologize. +2 femoral pulse. +2 femoral pulse bilaterally on each side. I'm now going to listen. Sure I don't hear a bruit there either. Checking with the bell. No bruit is noted. I'm now going to do some palpation and your right lower quadrant. Any rebound tenderness? Good. I'm just gonna still, just in case, check all of the quadrants. Good. I'm now gonna assess for the liver. There's a border. We check up here in the right upper quadrant. Liver was not palpable at this time. Okay. We're gonna move on down, or on up, I guess. We're gonna do your upper extremities. Okay. And then your lower extremities. So the right arm is warm to touch. No masses, lesions, or nodules are noted. Radial pulse is +2. And brachial pulse is +2. Capillary refill is >3. Was there any pain or anything on that? Good. I'm going to move on to the other side. Skin is warm to touch. No masses, lesions, and nodules noted. Capillary refill is >3. Radial pulse is +2. Brachial pulse is +2. There was no edema noted on either her left or right side on the bony prominences. I'm now going to access your lower leg extremities, okay? For biopsy. We're going to start obviously with the right side here. Any pain or tenderness upon palpation? Skin is warm, dry, intact. No varicosities noted. And no edema over the bony prominences. Dorsalis pedis pulse is +2. Posterior tibial is also +2, so that's normal finding, Miss Mason. Gonna move on to your left leg now. Okay, skin is clean, clear, dry, intact, no masses, lesions noted, no varicosities, no edema over the bony prominences. Posterior tibials +2, dorsalis pedis +2. Capillary refill is <3. Patient does have a clear nail polish noted to her toes at this time. Okay. Miss Mason, if you could please exit this side of the bed and come right this way for me. We're going to stand on this line of tape right here. We're going to use the Snellen chart and test your visual acuity.
Okay.
I'm going to go ahead and hand you this. When I tell you to, cover the eye. I'm going to stand close and check your nearsightedness. Can you please identify this photo?
Yes, it's an eagle face.
Okay. Cranial nerve 2 optic is intact. Now we're going to do more farsightedness and do your visual acuity. Okay. Cover your left eye. We're going to check your right eye first. Please read the smallest line possible.
D-E-F-E-T-P-O-T-E-C.
Good. Read the line below that.
L-E-F-O-D-P-C-T.
Good. Can you read the line below that?
No.
Okay. 20/15 vision in the right eye. Now cover the right eye. We're going to do the left.
Okay. Is it? I think it's the L-E-F-P-E-C. Wait, L-E-F-O-D-E-C-T.
Can you read the line below that?
F-D-P-L-T-C-E-O.
Good. And can you read below that?
No.
Okay, so line 10 was red. You have 20/13 vision in your left eye. Can you remove the covering of your eye and now read it with both eyes, the smallest line possible?
F-D-P-L-T-C-E-O.
Can you read the line below that? Okay, patient has 20/13 vision bilaterally. Okay, upon ambulation to the Snellen chart, patient's balance was appropriate, gait was intact, so that's part of that musculoskeletal portion. Okay, the next thing we're going to do is we're going to assess your cranial nerves. There's 12 of them. We're going to go in order, and if you have any questions, just please let me know. The very first one we're going to assess is your cranial nerve number 1, olfactory. So if you'll please close your eye, cover your left nair, and identify this scent for me.
Vanilla.
Good. Cover your right nair with your eyes closed, and identify this scent for me.
Pepper.
Good. Sorry, might make you sneeze a little bit. Cranial nerve 1 olfactory is intact. We just assessed cranial nerve 2 vision, so we can say that it is intact. We're now going to do 3, 4, and 6, which is your oculomotor, your trochlear, and your abducens, okay? So we're going to do 6 points of vision. We're going to cover the eyes, but I'll walk you through it. So just follow my finger. Good. 6 visual fields. She followed with bilateral eyes correctly. Now, if you'll follow my finger, hold your gaze with both eyes. No nystagmus noted. Now follow this finger. No nystagmus noted. Cover your right eye, please, ma'am. Follow my finger. No nystagmus noted. Doing visual fields. Good. Now to your right. Follow. No nystagmus noted. Once again, doing the visual fields by itself. The patient was able to perform that accurately. Next cranial nerve we're going to assess is your trigeminal, and it deals with your jaw. So what I want you to do is clench your teeth for me. Good. And keep your eyes closed. Okay? I'm going to check for any kind of like muscle spasms, movement, and I want you to identify the soft and the dull pain for me, please. Okay?
Soft.
All right, now we're going to do the next. Okay, no spasms, movement. Did you feel any pain, tenderness, or anything throughout either of those? Good. All right, the next one we're going to do is cranial nerve number 7, which is facial. So smile, frown. Good. Cranial nerve 7, facial is intact. Cranial nerve 8 is vestibulocochlear, which is also known as auditory. So I'm going to ding this on my hand, it vibrates, placing it in the center of your head. You're going to tell me if you hear it bilaterally or if you hear it on one side greater than the other, okay?
Bilaterally.
Good. That's a normal finding. I'm now going to do the same thing on my palm again. Hold it parallel to your ear. Let me know when you no longer hear it. And then I'm going to place it on the bony prominence back here and let me know when you no longer hear it. Seconds. 8 seconds. Did you hear it in front and when I put it back there? Yes. Good. We're going to do this side. Seconds. Sorry, I have to do this again. That part again. Okay, that was also 9 seconds. So that was the Weber and the Rene test that we just performed. The next one we're going to do is cranial nerve number 9 and cranial nerve number 10, which is your glossopharyngeal and your vagus. Okay, so to do that, I'm going to start by eliciting a gag reflex. Okay, I'm going to just kind of tickle the back of your throat. Okay, all right, the next thing that I want you to do is take a drink for me. Good. Stick out your tongue and say, ah. Cranial nerves 9 and 10 are intact. Cranial nerve 11 is your spinal accessory. I'm just going to have you move your shoulders up and down. Push. Good. Now push against my hand. Push against my hand. Cranial nerve premolar spinal accessory 11 is intact. Last one is your hypoglossal, which deals with your tongue. So if you'll just stick your tongue out for me, move it up and down. Good. I'm going to put this tongue depressor in your tongue and you push up against it. Good. Cranial nerve 12 is intact. Muscle strength with the tongue is about +5 and appropriate. All right, that kind of covers your cranial nerves. Next, we're going to move on with your musculoskeletal. So you perfectly ambulated for me. We have no trouble there. Can you go ahead and just kind of lay back for me? And then you'll come right back to where you were in just a second. Okay. So the shoulders and iliac crest are aligned appropriately with one another. Just lay there for just a second. Do you feel any tenderness, pain in your joints or anything? The phalange joints look good. How about your wrists? No crepitus noted in the phalanges, the wrist, pain or tenderness. How about the elbow? No crepitus noted, pain or tenderness. How about the shoulder? No crepitus noted, pain or tenderness. Make a fist for me. Try to open your fingers. Good. Muscle strength there is +5. Now try to make a fist. Muscle strength is a +5. Pull your arm towards you. +5 muscle strength. Push it down. +5 muscle strength. I'm going to go on to your other arm. Okay. We're going to start by just feeling again any pain, tenderness, or anything noted. Okay, joints are appropriate. No crepitus noted in the wrist or the phalanges. Now do the elbow. No crepitus noted. Any pain or tenderness in that joint? Good. We're going to do the shoulder. Pain, tenderness, crepitus noted. Awesome. Okay, so make a fist for me. Push your fist out. Good. Muscle strength is a 5 in the hands and phalanges. All right. Now we're going to pull your arm towards you. Push your arm towards me. Muscle strength is a +5 in the arms. Sit on the edge of the bed for me again, please, Miss Mason. Okay, so we're going to look at your neck. No crepitus noted. Any pain or tenderness? Okay, can you do a full circle with your neck? Can you lean it forward, now backward, side, and side? Good. Okay, and your shoulders. Can you raise them up for me? All right. Good. Muscle strength in the neck was a 5, and muscle strength tone in the shoulders was a 5 as well. All right. The next ones we're going to do is your lower extremities. So can you wiggle your toes for me? All right, good. There's appropriate movement bilaterally in the phalanges of the feet. I'm going to just feel your toes. No crepitus noted, pain or tenderness. All righty. Pain or tenderness in the ankle. No crepitus is noted. Pain or tenderness in the knee. Okay, no crepitus noted, and all of those joints are in correct placement. Roll your ankle in a circle for me. All right. I want you to take your knee while it's relaxed and push forward. Good. +5 muscle strength. Pull towards the bed. +5 muscle strength on the left. We're going to move to the right. I'm going to feel this side. Any pain or tenderness noted? No crepitus is noted in the phalanges of the feet or in the ankle. Any pain or tenderness noted? Okay. No crepitus is noted in the kneecaps. Turn your ankle in a circle. 4 range of motion bilaterally in the ankles. All right. Push your leg out. Okay. Pull it towards you. All right, patient has a bilateral muscle strength +5 in both of the lower extremities. While you're sitting there, we're going to do a little sensory test. So what I want you to do is close your eyes, and you're going to either feel a soft, I'm going to just show you what soft is, and then this is a sharp. And you let me know when you feel that. We're going to do upper and lower. Just keep your eyes closed for me, and then tell me each one. Soft. Sharp. Okay, I'm going to now do your lower extremities. Sharp. Soft. Soft. Sharp. Patient's sensory on her upper and lower extremities is intact. All right, I already checked the joints of your hands, but I want you to close your eyes. You're gonna feel a little vibration in the distal portion of your thumb phalange. So just let me know which hand you feel it on, okay? Okay. Right. Relax it for me. Right. Okay, I'm gonna do it again. same thing on your feet, okay?
Okay. Left. Right.
Good. All right, next thing I want to do is I'm going to test your jaw. So what I want you to do is open and close your jaw. There is actually popping and kind of like a crepitus noted on both sides. You're actually not supposed to feel that, but it is very common in people. Next thing I'm going to do is I'm going to test your deep tendon reflexes, okay?
Okay.
All right, so we're going to start with your brachioradialis. +2, I'm going to do your brachial, bicep, +2. We're going to do your tricep, +2. Brachioradialis, +2. Bicep, +2. Tricep, +2. I'm now going to do your patellar and your Achilles on each one. All of your upper extremities, brachioradialis, bicep, and tricep were all +2 throughout. So here we go. On your patellar on the left, +2. Patellar on the right, +2. I'm now going to do your Achilles tendon, which is on the back of your foot. +2 on the left Achilles tendon. +2 on the right Achilles tendon. All right. I'm going to test your gravesthesia. So what I want you to do is close your eyes and turn your palms upside down for me. I'm going to draw either a letter or a number, and I want you to identify it for me.
Okay. A.
That is correct, and I'm now going to do the other side. You tell me if it's a letter or a number.
8.
And that is correct. Patient passed the gravesthesia test. We're now going to do the stregnosis test. So I want you to close your eyes. Palms up. I'm going to place an object in your hand. With your eyes being closed, I want you to identify that object. You're going to have 3 objects per hand, and they will be in random order.
Okay. Paperclip.
That is correct.
Key. Coin.
Correct. Now we're going to move to the right.
Key. Paperclip.
Correct.
Coin.
And that is correct. So those were the 3 items: key, paperclip, and a coin. And patient passed that part of the sensory and cerebellum test, which is the stregnosis. Next thing you're going to do, if you could just stand up for me. We're going to kind of come on this other side of the bed. As you can see, the patient ambulates appropriately. So you'll just start over there. All right. You'll just walk towards me and walk back. Turn and face me. Walk on your heels towards me. All right, walk on your toes backwards. Do a deep bend at the knees. Good, heard a little popping there. And then I want you to stand on your left foot and hop up and down. Okay, stand on your right foot, hop up and down. Good, all of those were appropriate movements. Next thing I want you to do is I just want to make sure you have full range of motion in the upper parts of your arms. Can you do that? Good. Now step forward, kind of come about here so we can see. What I want you to do is we're checking the spine now. Can you lean back for me? All right, now bend over, touch your toes, and let your arms dangle. Patient has full range of motion at the spine. I'm now going to assess your spine. I will try to keep you covered. I'm going to just lift this part of her gown as much as possible. I'm going to follow her spine, cervical, thoracic, lumbar all the way down, and there are no signs of scoliosis noted, which is the normal finding. Clean her up. Thank you, Ms. Mason. I really appreciate your time and you allowing me to do my physical assessment on you. Thank you very much.